All right. Hello, my name is Neha Devliker, and I'm joined by my colleagues to present about understanding the basics of Medicare. Going further into introductions, my name is Dr. Neha Devliker. I am the current Safety Net Health Equity Fellow with Nova Scripts Central and the American Pharmacists Association in Virginia. I am also joined by Dr. Jenna Goins and Dr. Sydney Westervelt. Dr. Goins is the current Health Disparities and Outcomes Research Fellow with the Toro College of Pharmacy in New York. And Dr. Westervelt is the current community-based pharmacy resident with Nuvance Health in Connecticut. Through our individual programs, we all share mutual goals of promoting health equity by increasing the health literacy of our patients and their communities, improving the understanding of the healthcare system of the United States, breaking down barriers to healthcare and medication access, and lastly, providing helpful resources to patients that can help them take charge of their healthcare journey. Now, let's go over our objectives for this presentation. Firstly, we are going to explain what Medicare versus Medicare Advantage is, what it means to be dual eligible. Secondly, we're going to help you identify and understand the differences between Medicare Part A, Part B, Part C, and Part D. Thirdly, we are going to review with you how to sign up for Medicare. And lastly, we are going to help you understand how the new Inflation Reduction Act impacts Medicare in the coming years. Now, before we start going through these objectives, we want to see what you already may know about Medicare. At this point of the video, we request that you pause the video, scan the QR code on the screen, or click the link at the bottom of the screen if you have the slides to take a survey that assesses what you already know or don't know about Medicare. You will take the same survey at the end of the presentation so you can see how much you learned from watching the video. So if you have not already done so, let us take a pause here so that you can take the pretest. All right, we will now begin the presentation. So let's first talk about what the difference is between Medicaid and Medicare. Medicaid and Medicare are two completely different programs. Medicaid is a state-run health insurance program that provides hospital, medical, and prescription coverage. There are state-specific rules about who is eligible for Medicaid and what all it covers. If you would like more information on your state's Medicaid program, you can contact your local medical assistance agency, social services office, or get state contact information by visiting the link www.medicaid.gov. We do want you to note, however, that even though Medicaid and Medicare are two completely different programs, some people qualify for both Medicaid and Medicare. Now going into what is Medicare. Medicare is a federal-run health insurance program for people who are 65 years of age or older. There are also exceptions to this age cutoff. Say if you are younger than 65, you can still qualify for Medicare if you have certain disabilities, or have permanent kidney failure, or have amyotrophic lateral sclerosis, or more widely known by its acronym ALS. We will discuss more in depth about eligibility requirements later in the presentation. Now let us take a look at the different parts of Medicare. There are 4 different parts. We have Medicare Part A, Part B, Part C, and Part D. Medicare Parts A and B make up what is known as Original Medicare. You should know that while Medicare helps pay for healthcare, it does not help pay for all medical costs or costs for most long-term care. The reason that Medicare is split into different parts is to give you a choice for how you want to get your Medicare coverage. So what does each part of Medicare cover? So Part A of Medicare coverage is generally known as hospital insurance. Part A covers costs attributed to hospitals, skilled nursing facilities, hospice, and home health. Part B Medicare coverage is generally known as medical insurance. Part B covers costs attributed to clinic visits, lab visits, surgery, medical equipment, and preventative exams. Part D Medicare is known as drug coverage. as the drug coverage part of Medicare and covers the costs for prescriptions. Part C combines Parts A, B, and D coverage, bundling them and adding coverage for eye, dental, and hearing. Medicare Part C is also known as Medicare Advantage. Now that we have broken down the parts of Medicare, let's talk about who runs the program. So the Social Security Administration is actually in charge of the Centers for Medicare and Medicaid Services, also known as CMS. Social Security processes the enrollment application for Original Medicare, Parts A and B, and has information about the Medicare program. It is always important to notify Social Security in a timely manner about any address changes, name changes, or in time of death. You know now that you will be sending your Medicare application to Social Security, but when exactly do you apply? You should sign up for Medicare within a 6-month time frame around your 65th birthday. More specifically, you can start signing up for Medicare 3 months before your 65th birthday up until 3 months after your 65th birthday. You can apply for Medicare using the link on the screen or visit www.ssa.gov. It is so important that you enroll on time for Medicare to avoid any late enrollment penalties. And we will talk about these penalties on the next slide. So the 3 months before and after your birthday to sign up for Medicare coverage is known as the initial enrollment period, when you are first eligible for Medicare. If you do not sign up within the 6-month time frame, you may have to pay an extra amount called a late enrollment penalty. These penalties can be added to a monthly premium, and they are not just a one-time late fee. They can be charged for as long as you have that type of coverage, with most people paying a lifetime penalty, unless you have Part A, where you have a time frame of the penalty. For the penalty, that's a bit different than a lifetime penalty. Penalties can increase the longer you wait to sign up for Medicare based on how long you go without coverage that is similar to Medicare. So what if you already have insurance coverage at the time of your initial enrollment period that is similar to Medicare? In that case, you'll have to provide a document called Medicare Form CMS L564 in order to not be penalized for not signing up for Medicare at 65. This will help avoid late penalties when enrolling in Medicare Part B, and the form will need to be completed by both employee and employer. So we already went over a general overview of what each part of Medicare covers. Now let's go over the eligibility criteria for Parts A, B, and D. So we know that Medicare Part A is hospital insurance. So to be eligible for Part A Medicare without premiums, you need to be at least 65 years of age or older, be a citizen or permanent resident of the United States, and meet one of the following criteria. You get benefits from Social Security or railroad retirement. You or your spouse worked long enough in a government job through which you are paid Medicare taxes. You are the dependent parent of a fully insured deceased child, also known as survivor benefits. Even if you don't meet these requirements, you may still be able to get Medicare Part A by paying a monthly premium. So, what if you are younger than 65? You can still get Part A for no cost if you meet one of the following criteria. If you have had Social Security disability insurance for 24 months, if you have a disability pension from the Railroad Board and meet certain conditions, if you have ALS and Social Security disability insurance, if you have worked 10 years in a government job and you have had Social Security disability insurance for 24 months, if you are the child or surviving spouse who is aged 50 or older of a worker who has worked long enough under Social Security or in a Medicare covered government job, and you meet the requirements for the Social Security disability insurance program. And the last criteria is if you have permanent kidney failure and are on dialysis, or if you have had a kidney transplant and meet one of the following criteria. You worked 10 years paying Social Security or the Railroad Retirement System. You have worked 10 years in a Medicare covered government job. You are the child or spouse or divorced spouse of a worker who has worked 10 years paying either Social Security, RRS, or in a Medicare covered job. Now let's talk about the qualifications to be eligible for Medicare Part B, or medical insurance. Anyone who is eligible for Medicare Part A can also enroll in Medicare Part B by paying a monthly premium. Some people may pay higher premiums with Part B if they have higher incomes. You can find more information on the rules for those with higher incomes using the link on the screen. If you are not eligible for Part A at no cost, you can buy Part B on its own without having Part A. To do so, you must be at least 65 years of age or older and be either a US citizen or a lawfully admitted citizen who has lived in the US for at least 5 years. However, you can only sign up for Part B during designated enrollment periods. Now I'm going to pass it on to Dr. Westervelt.
Okay, so Medicare Part D. Medicare drug coverage, or Medicare Part D, helps pay for prescription drugs that you need. It is optional and offered to everyone with Medicare. Even if you don't take prescription drugs now, it is still important to consider getting Medicare drug coverage in case you may need drugs in the future. Anyone with original Medicare, either Part A or Part B, is eligible. Part D benefits are available as a standalone plan or built into Medicare Advantage unless you have a Medicare private fee-for-service plan. But the Part D benefits work the same way in either plan. Again, joining a prescription drug plan is voluntary. However, you will have to pay a monthly premium for the coverage. Some individuals with higher incomes will ultimately have to pay a higher monthly premium. For more information on rules for higher income beneficiaries, please click on the link provided. Moving on to American Indian and Alaskan Natives and Medicare. There are special rules for the Centers of Medicare and Medicaid Services, also called CMS, when working with the Indian Health Services. We're not going to go into depth about this, but I've provided both a link and a video if you'd like to learn more. Dual eligible refers to those who qualify for both Medicare and Medicaid benefits. Dual eligible beneficiaries receive health coverage from both the federal and state government. Medicaid also covers additional services beyond those provided under Medicare, including skilled nursing facility care, prescription drugs, eyeglasses, and hearing aids. Individuals who are dual eligible are automatically enrolled in a Medicare drug plan, and if you're partial dual eligible, you may qualify for a Medicare savings program. Being dual eligible is helpful as it lowers healthcare costs. Services covered by both programs are first paid by Medicare, then Medicaid will fill in the difference up to the state's payment limit. It also lowers monthly rates as Medicare enrollees who have limited income and resources may get help paying for their premiums and out-of-pocket medical expenses from Medicaid. Being dual eligible also offers coordinated care and long-term care. Medigap is sold by private insurance companies to fill in the gaps in the original Medicare Part A and Part B coverage. Individuals choose to purchase a Medigap policy to pay for some of healthcare costs that Medicare doesn't, such as copayments. You must have Medicare A and Part B in order to buy a Medigap policy. So again, in order to be eligible for Medigap coverage, you'd have to be enrolled in Medicare Part A and Part B. However, you will still have to pay your monthly Medicare Part B premiums. In addition, you'll also have to pay a premium to the Medigap insurance company. As long as you pay your premiums, your Medigap policy is guaranteed renewable. This means that it is automatically renewed each year, and your coverage will continue year after year as long as you pay your premium. It is also important to compare Medigap policies because costs can vary. Essentially, Medigap policies are standardized, and insurance companies must provide the same benefits. The only difference is the cost, and some Medicare policies also cover other extra benefits that aren't covered by Medicare. For more information, you can click on the link provided to start reading and comparing plans. There's also Medicare Advantage plans. If you choose a Medicare Advantage plan, you can buy a Medicare approved plan from a private company that bundles your Part A and usually Part D into one plan. Medicare Advantage plans were previously known as Part C, so you might have realized that we missed that one. This includes all benefits and services covered under Part A and Part B, plus prescription drug coverage, and may also carry additional benefits such as vision, hearing, and dental bundled together in one plan. If you decide to join a Medicare Advantage plan, you will use the insurance card that you get from your Medicare Advantage plan provider for your healthcare. Okay. Medicare Advantage plans include all of the following: Health Maintenance Organization or HMO plans, Preferred Provider Organization or PPO plans, Private Fee-for-Service plans or PFFS plans, and Special Needs plans or SNPs. You may also pay your Part A and Part B deductibles, coinsurance, and copayments, and you can apply at the link below. Sponsored Medicare saving programs are sponsored by state Medicare agencies and help pay for Medicare out-of-pocket costs if you have limited savings and income. Some programs may pay for Medicare premiums, and some pay Medicare deductibles and coinsurance. Only your state can decide if you qualify for help under these programs. There are also 4 different types of Medicare savings programs. So there's the Qualified Medicare Beneficiary Program that helps pay the monthly costs for Medicare Parts A and B, deductibles, coinsurance, and copayments and prescription drugs. There's the Specified Low Income Medicare Beneficiary Program that helps pay for Medicare Part B and also helps with prescription drug costs. The Qualifying Individual or QI program is similar to SLMB program, but also has a higher monthly cost. And then the Qualified Disabled Working Individual program is for individuals who have a disability and are working and lost premium-free Medicare A and Social Security disability benefits. So, when should you enroll in Medicare? Fall open enrollment occurs each year from October 15th through December 7th. An application for Social Security or Railroad Retirement benefits will trigger automatic enrollment in both Medicare Part A and Part B. I wanted to note that Part B is voluntary, and you do have the opportunity to decline in enrollment. Any changes made during fall open enrollment would take into effect January 1st. And how do you enroll? There are 3 different options, either by phone, online, or in person. To sign up by phone call, you can call 1-800-MEDICARE and follow the prompted menu options and enter identifying information. You can make an appointment to schedule a call and answer the phone at scheduled appointment times, and then mail or deliver requested items to the local Social Security office. You can apply online at the link below or ssa.gov, follow the listed instructions on the website, and again, mail or deliver the requested items to the local Social Security office. Or you can go in person. To identify a local Social Security office, you can click the link below, or you can call 1-800-MEDICARE and make an appointment. Again, remember to bring the necessary documents in for your appointment.
After you enroll in Medicare, you'll receive a red, white, and blue Medicare card. The card will indicate if you have Medicare Part A, Part B, or both. You should keep your card in a safe place so that way if you need it, you'll be able to retrieve it easily. If your card becomes lost or stolen, a replacement can be requested online by setting up a personal My Social Security account at www.ssa.gov or by calling the toll-free number at 1-800-772-1213. You'll also receive a Medicare and You handbook, and that describes your Medicare benefits and plan choices. When it comes to comparing coverage and premiums, there's several options. Because of this, it can be difficult to decide which one would be best for you. Medicare.gov shows you all your choices and can assist you in comparing them. You can also enter the current prescription medications you're taking to receive an estimate of your monthly and yearly cost for each plan. On the right side of the slide, you'll see an example of one of these comparisons, so you can see how the website breaks down coverage and costs. It's important to keep in mind that Medicare fraud and abuse does occur. Medicare fraud and abuse happens when there's billing for services that were not provided, billing for supplies that were not received, or when someone steals your Medicare number and uses it to submit fraudulent claims in your name. Awareness of these situations can help prevent them. Every year, Medicare loses about $60 billion due to fraud, errors, and abuse. Here's some things you can do to help prevent fraud and abuse. Protect your Medicare number and your Social Security number. Keep your Medicare card in a safe place. Reading Medicare's privacy practices can help you better understand how your information is allowed to be used. If you think you're experiencing Medicare fraud or abuse, you can call 1-800-MEDICARE to report it. To help protect yourself, do not give your Medicare card or number or Social Security card or number to anyone except your doctor or people you know should have it. Do not accept offers for free medical care. Do not allow anyone except your providers to review your medical records or recommend services, and do not join a Medicare health plan or drug plan over the phone. There's several different resources that can help explain different parts of Medicare. They're all useful to help understand how Medicare may help cover your healthcare services and medication costs. On this slide, you'll find links to several of these resources. A great place to start is by going directly to the source at cms.gov, which is the Centers for Medicare and Medicaid Services website that houses information on coverage, health plans, and quality initiatives. If you need a basic understanding of Medicare and don't know where to start, this is a great resource. The Patient Resource Center is useful for learning more about Medicare eligibility requirements, coverage options, and costs specifically for immigrant populations. They offer resources in a variety of languages so non-English speaking patients can access important information. The Patient Advocate Foundation provides a lot of information, including a dictionary of definitions and explanations of Medicare's glossary of terms. This is useful in gaining understanding to complex insurance terms. Senior Medicare Patrol aims to help prevent Medicare fraud. They offer a My Healthcare tracker, which is available for free to beneficiaries. This tool helps detect, prevent, and report suspected Medicare fraud, abuse, or errors. By tracking these things, you may not only help avoid fraud, but it can also help reduce the amount you end up owing. Coverage to Care, or C2C, is an initiative that was developed by the Centers for Medicare and Medicaid Services to assist beneficiaries in understanding health coverage and connect them to primary care and preventative services with the goal of helping enrollers live a long and healthy life. Understanding coverage can be overwhelming and confusing. CMS has created a roadmap which explains what healthcare coverage is and how to use it to get primary care and preventative services. They have resources available in different languages, including Spanish, Arabic, Chinese, Haitian Creole, Korean, Russian, Vietnamese, and tribal versions. This is a helpful resource so you can understand how to use your coverage and also to get the care you need in a culturally and linguistically appropriate manner. Faith-based organizations can use the Medicaid Toolkit to share important Medicaid and CHIP information with those in their congregations and communities. The toolkit includes ready-to-use resources, including bulletin inserts, key messages, social media messages, and more. Next, I'd like to offer some clarification on some common myths regarding Medicare. Myth number 1, Medicare is only for US citizens. This is not true. You do not need to be a US citizen to qualify for Medicare. Your qualification for Medicare depends on if you or your spouse have worked in the US and paid Medicare payroll taxes. If you have not paid these taxes, you can still get Medicare, but you'll have to pay premiums for coverage. Myth number 2, you must be retired to get Medicare. This is not true. Generally, Medicare is for those 65 years of age and older, and those are who are disabled, have kidney failure, or have ALS. Myth number 3, Medicare covers all your medical expenses. Unfortunately, this is also false. Medicare Part A and B are not free. You may pay premiums, deductibles, copays, and co-insurance out-of-pocket costs, just like with any other health insurance plan. Next, I'd like to address some common questions that beneficiaries may have. Who do I need to contact to replace my Medicare card? If lost or stolen, you should contact Social Security via telephone, email, letter, or by visiting a Social Security office. Can I have a Medigap policy and Medicare Advantage plan at the same time? The answer is no. Medicare Advantage plans cover many of the same benefits as the Medigap policy does. This includes benefits like extra days in the hospital after you've used the days allotted by Medicare. Can I switch Medicare Advantage or Medicare Part D plans? Yes, you can enroll in Medicare Advantage during the general open enrollment period, which is October 15th to December 7th. You can also switch Medicare Advantage plans and add on Medicare Part D during Medicare Advantage open enrollment period, which runs from January 1st to March 31st. Lastly, do I have to re-enroll in Medicare each year? The answer is no. Once you have enrolled, you don't need to take action to renew your Medicare coverage. As long as you continue to pay any necessary Medicare premiums, your coverage should renew automatically each year. On this slide, I'd like to share a story from an article posted in MedPage today about the cost of not understanding your benefits to highlight the importance. There are disparities that Medicare recipients experience due to lack of understanding their benefits. In this case, a patient with Parkinson's disease was receiving an injectable medication called Stelara, and he was taking this for his Crohn's disease for 5 consecutive years. A licensed medical professional would administer the expensive injection at no cost to this patient. Stelara is an expensive medication that typically costs around $40,000 per dose. However, Medicare covered all the cost of this medication for the patient under the Medicare Part B. On October 15, 2021, Medicare reclassified this drug as a self-administered drug, also known as SAD, and would no longer cover the cost if the medication was administered in the outpatient setting. Unfortunately, the patient was unaware of this change and continued to get injections administered in the clinic as he had previously done. Little did he know this medication was now costing him $43,543 out of pocket per dose. After receiving this dose for 7 months, this patient accrued a bill of $176,000. The patient stated that Medicare claimed he should have been aware that the medication was not covered because it could be administered at home on his own. He was also told that he should have read his Medicare and You handbook, which outlined this information. Our goal is to avoid unfortunate situations like this from occurring. To summarize some key points we discussed today, Medicare has 4 parts. Part A includes hospital coverage. Part B includes general medical coverage. Part D is used to cover prescription medications. And Part C, also known as Medicare Advantage, is a combination of Parts A, B, and D covering hospital, medical, and prescriptions. Dual eligible enrollees have both Medicare and Medicaid to help pay for healthcare costs. To enroll, you can visit www.ssa.gov, call 1-800-MEDICARE, or visit your local Social Security office.
Now, lastly, we are going to go over the improvements to Medicare that are coming in 2025 and 2026 due to the Inflation Reduction Act. The Inflation Reduction Act is a federal law with the goal of lowering prescription drug costs and making health insurance more affordable. So in the year 2025, we're going to see a cap on certain costs. One of those caps is a cap on your insulin costs. So there's going to be a $35 per month cap on the cost of each Medicare covered insulin product starting the year 2025. Additionally, they're going to be capping prescription drug out-of-pocket costs. So patients will pay no more than $2,000 in yearly out-of-pocket prescription drug costs starting in 2025. Also, in 2025, we are going to see some certain vaccines be at no cost or have no cost sharing under Medicare. So these certain recommended preventative adult vaccines that will be available at no cost include RSV, shingles, tetanus diphtheria combination vaccine known as TD, tetanus diphtheria and pertussis combination vaccine known as Tdap, hepatitis A, and hepatitis B. Starting on January 1st, 2026, there's going to be a drug price negotiation enacted. So Medicare is now able to negotiate the prices of certain medications with their manufacturers, increasing access to patients by lowering the cost of those meds. So there are 10 medications that are currently on the list for drug price negotiation, whose prices will go into effect on January 1st, 2026. And those are Eliquis, Enbrel, Entresto, Farxiga, Fiasp, Imbruvica, Januvia, Jardiance, Stelara, and Xarelto. If you have any more questions or need more information on the Inflation Reduction Act and Medicare, you can visit the link below at the bottom of the screen. So now that we have finished the presentation, we want you to take the same test that you took at the beginning of the presentation. After you take the post-test, we would like you to ask yourself and consider, did you learn a lot about Medicare from our presentation? Did you learn anything new? Did your score or knowledge improve or maintain from the beginning to the end of the presentation? Was there anything you learned that was surprising? And what other questions do you have about Medicare? You can pause the presentation here to take the post-test before we conclude. So thank you for listening to our presentation on Medicare. We hope that you found it helpful, and if you have any additional questions, do not hesitate to reach out to any one of us. Our emails are listed on the screen. Thank you. We will now conclude the presentation, and here are our references.